This unassuming medical clinic is on the front lines of healthcare delivery in Brazil. Located in Vila Canoas, a slum in Rio de Janeiro, it serves some 600 families from the surrounding community. A member of the health team, some of whom live in the slum as a condition of working here, shows us around.
Our vaccine campaign is done in this room.
We move by the messages posted on the wall, warnings about the dangers of smoking and dengue fever. The focus here is not just sickness, but lifestyle and prevention.
Here's the doctor's room, and she's currently seeing a patient.
The young woman being treated today is Joana Loureiro de Almeida Ricardo. She's 17.
I decided to come because I had a strange pain and I got worried. They gave me the medication I needed and I was treated very well.
And just as important,
did she have to pay for this visit?
No, I didn't have to pay.
health care in Brazil is a right. That's the law, and the state must pay for it. And so in this country of nearly 200 million people, there are no uninsured. And the array of free medical services extends from vaccinations to organ transplants to, more recently, sex change operations. Since Brazil made this vast array of services a constitutional right 20 years ago, many indicators of the nation's health have improved, such as infant mortality and life expectancy. And while some wealthier Brazilians opt out for private care, today 3/4 of the population relies on the public system.
I think any society has to provide basic health care for its members, and especially those who are the most vulnerable.
Dr. Daniel Becker is an expert in healthcare policy and helped create the national program that provides free primary health care here. He says Brazil's focus has been to deliver health care to those who need it most, the poor, who make up some 60% of Brazil's population.
And I think this has been done to a certain extent, not with the quality that we should have done it, but we could have done it, but in many ways in a pretty revolutionary and innovative way.
He's talking about the 25,000 community health care teams all across Brazil, like the one in Vila Canoas. Physicians are paid up to 3 times more to work in the poorest, often most dangerous areas. It is personal and proactive. They reach out even before the patients come in.
We try to always get into their homes.
Barbara Gomez, 24, is what's called a community health agent. She lives in Vila Canoas, and her job is to knock on as many doors as she can.
Our work is to register all the residents, and that way we can follow them, those who have hypertension, diabetes, those who are pregnant. We work in health promotion. It's not just about addressing the problems.
On the second floor, the clinic is sponsoring an art project for the developmentally disabled.
And what are you making today?
Today we're doing mosaics.
She tells us this work for her mind is good medicine too. And you don't have to go to a clinic like this to find free health care. In downtown Rio, we stumbled on a storefront setup offering free vaccinations against measles, mumps, and rubella. A woman in line was shocked to hear from me that shots in the States aren't always free. We discovered another vaccine booth, of all places, at a rodeo outside Sao Paulo. But offering so much to so many has put a strain on the system.
Everything is given, and everything is the right of everyone, and everything is free. So it is impossible, basically, doing that.
With the current focus on primary care, it often battles for resources with Brazil's hospitals. And the result? The hospitals often come up short. A recent study by the World Bank called most of Brazil's hospitals substandard and said that many deliver inefficient, poor quality care.
The hospitals are a very serious problem.
Are there long waits for complex procedures?
Absolutely, yeah. Very long waits and sometimes very bad quality.
I mean, isn't this an inevitable consequence when you try to be all things to all people?
No, because we have to have a social responsibility regarding health. And ideally, you have to provide optimal health care to everyone. Of course, at some point, the system will find its limitations because you cannot do everything for everyone at any time.
Becker says Brazilians still prefer their system, with all its flaws, to that of the U.S., where so many people have no guaranteed access to care at all.
I think this is really sad. In a society which is so rich, to leave people out of the system because they're poor, it's pathetic.
That's the issue millions of Americans are pondering as the new administration prepares to overhaul our healthcare system. Brazil is a good case study of the highs and lows of universal health care. I'm Edie Magnus reporting for Worldfocus in Rio de Janeiro, Brazil.